How are you, Tim?
Fine, thanks, Darren.
I'm not a surgeon.
No, but there's this comment, ain't nothing that can't be stuffed up by an operation.
And that's our 2-minute rep for today.
Correct.
So, Tim, you're not a surgeon, but what do you know about surgery?
Well, a few things. See lots of people that have surgery.
Yeah.
Involved in research around the outcomes of people following orthopaedic surgery.
So you don't have to be a surgeon to know a bit about surgery.
No, but this comes from this concept that an orthopaedic surgeon said that line to me once.
Yep.
Because often people have tried things and they're not getting better, or they want a quick fix, and it's very tantalising that you could just get something done and the problem's fixed. Until, for a proportion of people, things are worse or no better after a surgery, and then suddenly it's not such an easy fix or a great idea.
So if someone's injured, when should they see a surgeon?
Well, the good thing is, Darren, we have clinical practice guidelines around this.
Oh yeah, I've heard of those.
Yeah. So there's kind of useful, and there's guidelines around, if we're talking musculoskeletal pain, there's guidelines around radiology. So if there's been a trauma, well, perhaps we need to investigate to rule out things like fractures or other traumatic injuries. And then the guidelines around those say these ones need surgery, these ones do fine, managed conservatively. So following guidelines is a pretty good start.
And where would I find the guidelines, Tim?
Well, there's a thing called the internet, Darren.
Yeah, I've heard of that too.
Yeah.
Say someone's had some conservative management, it's not going well, a surgical opinion might be got. What would you tell the person going into surgery or into that consultation?
Yeah, and we do this a lot as in our role as specialist physiotherapists reviewing complex cases, but essentially there's this concept called shared decision making, where you as a person want to know all the information, so the pros and cons about a surgery, the potential outcomes of that surgery, both likelihood of success and potential side effects, and then you make a decision in consultation with your surgeon and possibly your GP and other family members. There is a Choosing Wisely campaign about the questions you should ask, so people can Google that.
Oh, that's good.
And you can go in with these questions to ask your surgeon or even your physiotherapist about what does this treatment involve and what are the risks.
What do you I have a few things that I think of as risk factors for people in recovery in general, but particularly apply to surgery. So obesity is one, smoking is another one. If you have other medical comorbidities, particularly like diabetes or just poor health in general. If you have dominant or really high level psychosocial issues, and also if you have a really dominant central pain sensitivity kind of issue, they're the kind of things I think of as risk factors. Or do you have other ones beside that?
They're definitely the main ones, and the issues that we come across is people with those risk factors aren't being told in their decision-making process around surgery, these are risk factors. And I mean, we've seen plenty of people that don't go well. So it's just an area that we need to be conversant on and realistic about. And there's, medical benefits scheme information in Australia and certainly the UK around, common orthopaedic procedures that are being taken off the list because they don't match guideline-based care, and people don't necessarily do better with those than they do with conservative management. So it's understanding surgery absolutely has its place and it's really important, but when is that? And that's evolving, and we need to be up to date.
Yeah. So has conservative management been exhausted? What's your individual risk profile going into that? And does the surgery kind of make sense?
Very good.
Good.
Cheers.